Today on Rescue Vet, owners of a panting Labrador retriever visit a third veterinarian to determine the cause of this strange ailment.
Somebody just told you right now, this is a tumor and it's likely to come back and it's likely to be a problem again in the future. The question you'd have to ask yourself is, would you stop now?
Will the diagnosis be cured by a simple procedure, or will the owners find out that the prognosis is far worse than anticipated? A miniature horse with a big heart and severe case of colic is brought to one of the only equine clinics in the Southeast. Did this horse get to the vet in time to survive a common illness, or will euthanization be the only answer?
75% of the horses that have it survive, but 1 in 4 either die or we have to euthanize on the table.
A routine exam becomes far more difficult than expected when doctors are faced with a potentially aggressive 100-pound Pitbull. When an overgrowth is discovered, will biopsy results reveal that it's just a benign mass, or is it cancer?
This potentially may need part of the mandible even removed.
Veterinary Specialty Care, located in Mount Pleasant, South Carolina, is one of only a few 24-hour emergency clinics in the region. Veterinary Specialty Care is a place that other veterinary clinics turn to when they don't know the answers. With cardiologists, oncologists, neurologists, veterinary surgeons, and internists on staff, this clinic goes above and beyond ordinary veterinary care. Debbie Payne and her daughter Christy traveled 2 hours today from Myrtle Beach, South Carolina with their 9-year-old lab Dixie. Dixie's panting has increased significantly over the last few months, and now she is barely able to eat, drink, or bark. Due to the uncertainty of Dixie's prognosis, Debbie was referred to veterinary specialty care.
Obviously the breathing's the issue, okay? Is that the first thing you noticed?
Well, about 6 weeks ago, she couldn't bark. All of a sudden, it's like, you can tell her mouth's moving, but nothing's coming out.
And it was all of a sudden.
This was the third vet. The first vet told her she was overweight, so I put her on a diet. She lost 8 pounds, but the barking never came back. The breathing still heavily panting, so I waited about 4 weeks. Then took her to another veterinarian. They did x-rays, and that's when they found the mass in her larynx. So they couldn't do the surgery there because it needed some type of surgery, and so they referred us here to the specialist.
So she's choking when she drinks?
Right, just all the time.
And this all came on suddenly?
I think it was a progressive thing, but we just noticed it when she stopped barking.
They came in and they thought it was a tumor, and neck x-rays can be hard to read. So we'll get x-rays a lot of times from veterinary clinics, and they'll think there's something there. They'll think there's a bone in the throat, they'll think there's a pork chop bone stuck in the esophagus, and it's really some of the bones here in the neck that can be confusing to look at, and gave the referring veterinarian the idea that the breathing problem was a tumor.
With the fear that Dixie is overheating due to restricted airflow, Dr. Bianucci takes her temperature, which at 103 degrees is higher than normal and calls for concern. Dr. Bianucci decides to take more x-rays of Dixie's throat to see if the mass is in fact a tumor. Located in Youngs Island, South Carolina, Edisto Equine Clinic is one of the only equestrian facilities in the Southeast. The clinic offers 24-hour emergency care to horse owners within a 6-hour radius.
We see our patients so much more year in, year out. You get 2, 3, 4 visits a year. You're just a lot closer to those patients.
Cheryl Phillips has traveled 2 hours from Bluffton, South Carolina with her miniature horse Dasani, who is suffering from colic. The cause of colic is currently unknown.
This is Dasani. She's a miniature horse. I bought her mom, and she was born at my house into my lap and spoiled rotten. We do a lot of work with Heroes on Horseback, which is a program in Bluffton, South Carolina. They work with the handicapped children, and they ride horses, and whenever they need a face to go out and be in the public, they call us, and Dasani goes and parades for them, and she goes to any function.
Dasani, the miniature, basically came in with a very common complaint that we see, which is basically colic. We look at that in similar terms with a baby. Colic is just basically abdominal pain.
She's starting to get a little painful. She's been pretty comfortable all night, but it's heartbreaking.
Dr. Malark suspects that Dasani's condition may be anterior enteritis. This is an inflammatory condition of the intestine where fluid can accumulate in their stomach. Dr. Malark administers a fluid IV to replace normal IV fluid that has been lost to the intestinal tract. As the fluid runs through Dasani's intestinal tract, electrolytes are put back into her body, making her stronger and healthier.
You know, it had been going on for over a day or two and showing some severe signs, so rather than maintain the horse in the field, they decided to come to the clinic to see if it could be monitored. And our big thing here is we're trying to decide, does she have just a medical problem that we can treat with fluids, or is there something in there that's going to require surgery?
When he told me that our option was surgery, Edisto Equine Clinic was where we had to go.
A nasogastric tube is placed directly into Dasani's stomach to help drain fluids from the intestinal tract that may accumulate toxins while it sits in her stomach. If Dr. Malark is successful in removing a majority of the toxic fluids, there's a chance that Dasani will not need surgery. Bees Ferry Veterinary Hospital, located in Charleston, South Carolina, is comprised of a compassionate group of people who have dedicated their lives to the health and welfare of animals. With a wide variety of services offered to patients, varying from dogs and cats to local wildlife, it is a guarantee that there is never a dull moment at Bees Ferry Veterinary Hospital. Today, an 8-year-old Pitbull named Chuko is being brought in to have an overgrowth in his mouth examined. This is the veterinary staff's second attempt at examining Chuko's mouth. During his first visit, Chuko was too aggressive and the staff was unable to conduct the examination. His owner has brought him in again, and this time, Chuko will be sedated.
He came in the other day for a physical exam to check out some overgrowth in his mouth, and we could not do it because he was too aggressive. So we rearranged it to have it set up today so we can see what's going on. We'll look in the mouth and see exactly what the owner's talking about, because like they said the other day when he came in, we couldn't get a very good view of it. So we're gonna look to see what is going on with that mouth, see what she's talking about, the overgrowth. Maybe take a piece of that and send it to the pathologist and see what it comes back at. See if it's something we need to worry about and possibly either send him to a surgeon, maybe that needs to take that out even more, or if it's just something that's just cosmetic. All right, since he can be a little bit aggressive, if I can get you to go ahead and slip this muzzle on him for me, please. And then we'll go ahead and give him his drugs to sedate him with. We do see a good many pit bulls. I even have one myself at home, and most of them are not aggressive. This one, he can be a little dog aggressive, so we're just taking a little extra cautions to make sure, we keep everybody safe.
We have animals that are coming in here who are afraid, who are hurt, who are scared, and they may be the most perfect animal at home, but here their emotions can get the best of them, and their behavior can change in a veterinary setting. We're poking and prodding and taking a temperature and drawing blood, and so the nicest animal can turn on you.
We went ahead and gave him some pre-meds to sedate him with, and we're waiting for those to kick in. So as soon as he is sedated, we're going to go back in and take him to the back and start checking him out and see what's going on. So yeah, it wasn't so bad, was it? So what I'll do, I'll go ahead and cut the lights off in here for you and let the two of y'all chill out and let the drugs take effect, okay?
Back at Bees Ferry, the sedative has kicked in, and Chuko is finally ready for his oral examination.
There you go, buddy. You feeling all right, huh?
Time is of the essence here, so Jimmy must move quickly.
All right, let's see if we can find a vein here, buddy.
Jimmy struggles as he tries to find a vein in Chugo's arm to administer the anesthesia.
All right, let's see if I can hit this thing. He's a little chubby side. He's not having the best vein here in the world.
Because Chugo is slightly overweight, it is difficult to identify a vein.
With him being a little overweight, his veins are not popping out very good. His blood pressure is a little low, so I'm having a little trouble finding a vein. And I'm gonna look at the other leg, see what it looks like. See if it's a little better.
As Jimmy continues to struggle finding a vein, the sedative begins to wear off. Dr. Mayers is called in to complete the task. Once Chugo is put under a plane of anesthesia, an intubation tube is passed down his trachea so gas anesthesia can be administered to keep him fully anesthetized, while Dr. Mayers takes the biopsy.
This dog has this growth in his mouth, and it could be one of two things. It could be in what's known as an epulus, which is a benign growth, non-cancerous, that does not spread but can get in the way of the tooth, and the calculus and tartar can get kind of shoved in there and create infection and problems. So that would be your best case scenario. Or this could be oral cancer, such as squamous cell carcinoma, melanomas. Those are real common in animals' mouths. So what we're going to do today is debulk this and send it off for biopsy. If, God forbid, this is squamous cell carcinoma, this potentially may need part of the mandible even removed if it was that aggressive of a cancer. So we'll just have to see.
At Edisto Equine Clinic, Dasani is fighting for her life while Dr. Malark tries to determine if surgery would be the best treatment for her case of colic.
Surgery is a little dependent on the lesion we find. Potential lesion that we suspect in her, we seem to have a pretty good success rate here, in the high 80s to maybe 90%. Colic surgery, it's probably about 75% of the horses that have it survive. About 1 in 4 either die or they have a lesion that we have to euthanize on the table. The success rate is dependent on what part of the intestine is involved. That's what affects the prognosis more than anything.
She's got a low white count and a fever that's probably more indicative of enteritis. We don't know for sure.
If it turns out that she's just got a medical problem like enteritis, that's in the high 90s, 95% success rate.
They may open her up and may be able to fix it pretty easily. May open her up and find out that it's not worth fixing and we may lose her. So, she's been quite a trooper. She's tough.
When you find a tumor, when you think you've got a tumor, okay, it's a good idea that you have to stage it, okay? So you're gonna wanna take a look and see, first of all, where is it locally, okay? And then you wanna see, has it gone anywhere else? If somebody just told you right now, this is a tumor, and it's likely to come back, and it's likely to be a problem again in the future, the question you'd have to ask yourself is, would you stop now, okay? But I would suspect that we'd want to try to get this out of there and give her an airway for whatever time she has left, regardless of whether this is benign or not. So my recommendation would be to do an excisional biopsy if possible, and actually take this tumor out from inside the larynx. When you care, you feel that client's emotion, and it does make you sad. But you can't hold on to that because you have to give the exact level of care to the next case. So it's almost like you have to have a little bit of bipolarism and a little short-term memory loss, and you just have to be able to move on.
Dr. Bianucci is still unsure of Dixie's prognosis, but is able to narrow it down to 3 possible prognoses. One of them could be fatal.
Labrador Retrievers are one of the most popular breeds in the United States, and one thing that I see over and over and over again is that these dogs develop a problem called laryngeal paralysis, and that's where they have a progressive loss of the innervation to their larynx, and they lose the ability to breathe. They cannot open their airway enough to meet their oxygen needs. I can't think of anything more miserable than not being able to breathe or not being able to regulate your temperature. Part of the issue with Labrador retrievers is that they can get a thing called laryngeal paralysis. And it turns out that that's not what it is, then we've got to back up and go the other way, okay, in terms of deciding what are we going to do to relieve this obstruction and get a biopsy. We can make all of those decisions at the same time. I think regardless of which it is, it's going to be the same flow. We're going to do the evaluation and then go into surgery from there. Okay. We're probably better off doing it, watching her overnight, reevaluating her in the morning, and then sending her home. You know, if it's laryngeal paralysis, it's a genetic thing. Okay, it's a Labrador problem. You know, there's certain lines of labs that if they live long enough, they'll all get it.
I never knew that was a hereditary in labs. I always heard about hip dysplasia, you know, having trouble with their hips, but I've never heard that.
If it's laryngeal paralysis and it goes the way 99% of them go, she should live to her, whatever her preordained allotment was, okay? If it's a tumor, then it depends on what type of tumor, okay? If there's some kind of a benign polyp in there, shouldn't change a thing. If there's a, big, high-grade cancerous mass in there, that could be 4 to 6 months. You just don't know.
After explaining each possible prognosis, Dr. Bianucci decides it's best to begin with the surgery in hopes that laryngeal paralysis is the cause of Dixie's discomfort. If the prognosis is in fact laryngeal paralysis, Dixie will most likely have a full recovery. However, there is still a chance that Dixie could have a cancerous tumor.
If it's what he thinks it is, that we'll go ahead and have the surgery and hope for the best. If it's a mass with cancer, we probably won't do anything, but just let her be comfortable, because I don't want to go through chemo, put her through that kind of stress. So, and of course, when you hear mass or they call it tumor or cyst, then you think cancer. And cancer in an old dog, I wouldn't want to put her to sleep, but if she has cancer, we would just try to make her comfortable. It's an hour and a half drive, so I'm sure we'll probably just let her stay and get the surgery done, and we'll come back up tomorrow and pick her back up.
Dr. Bianucci is hopeful that the surgery will give Dixie her life back, but without a conclusive diagnosis, nothing is certain. Now that Chuko is fully anesthetized, Dr. Mayers is able to examine Chuko and take a biopsy without the risk of being attacked.
This is a jar full of formalin that will preserve the specimen. We're going to send it off to a pathologist to read and then tell us the nature of it. But you can see, this is a quite invasive mass. So if this, God forbid, is cancerous, we really need to do more than what I just did. This is just getting a piece. So I'm going to see if this will clot on its own first before I start trying to stop the bleeding on my own.
Sutures will not be enough to stop the bleeding, so Dr. Mayers must resort to a different method.
So what I'm going to do is I'm going to use electric cautery to stop this from bleeding, because a suture won't do it. So it's kind of like I'm burning the end a little bit of the little capillaries here to close them off from bleeding. So you can see it kind of just clots it. Our cat's worried. So see, that stopped the bleeding quite nicely. So we're done in the mouth. So we're waking up from anesthesia right now. We're still a little weak in the hind end. We didn't reverse everything, so there's still a little sedative on board so we can be a little tranquilized and comfortable. And the owners are going to come around 12 o'clock to come pick up.
We're going to put her on fluids and monitor, get her on some medications. I'll probably start her on some antibiotics and stuff. And then if she continues to really be hard to control with pain, I think then you got to look in.
People seem to be a lot more connected to the horse, and obviously they're bigger animals, so when they have the kind of illnesses that bring them here, the bills are huge. So that's somewhat limiting too.
Dasani is taken to an outdoor stable where Dr. Malark and his staff will monitor her for a few days. Dr. Malark is still uncertain if Dasani will need to have surgery or if the fluid IV will be enough to save her. Cheryl's emotions are running high as she anxiously waits to hear the prognosis. If surgery is the only option, Cheryl is willing to take that route. However, surgery can be extremely expensive and risky. The prognosis will take a few days to determine, so Cheryl decides to leave Dasani in the hands of Dr. Malark and his staff in hopes that she will make a full recovery.
I'm sure we'll probably just let her stay and get the surgery done, and we'll come back up tomorrow and pick her back up.
They may open her up and may be able to fix it pretty easily. May open her up and find out that it's not worth fixing and we may lose her.
This potentially may need part of the mandible even removed if it was that aggressive of a cancer. So we'll just have to see.
Just a handsome baby. Yeah.